Hello and welcome to our workshop, the Medical School HQ workshop series, how to find some clinical and shadowing experience, because as you'll find out, it might be a little bit important, right?
Yep.
Right.
Yep.
Dr. Scott Wright is with me today, former director of admissions at UT Southwestern, retired executive director at TMDSAS. How you doing, my friend?
Doing really well. It's a beautiful day in Austin, Texas, 74 degrees and sunny. So excited about being inside for this.
We
I'm
gotta
kidding.
get you a red sweater and you can start singing It's a Beautiful Day in the Neighborhood.
It's a beautiful day.
Yes. Love it. All right. Well, again, with your expertise and with Courtney's expertise from a director of admissions standpoint, we're going to dig into that. Courtney Lewis, former director of admissions at Burrell College of Osteopathic Medicine. How are you, my friend?
I'm good. Weather is also nice here in Seattle. So the two rainiest places, we are getting some sunshine, and I think that equals happiness. So
Nice.
doing well.
Yep.
Love it. And my name is Ryan Gray, the founder of Medical School HQ, co-founder at MAPT, and all-around cool guy, supposedly. At least my mom says I'm special, so I'm gonna stick with it. Today we are talking about how to boost your application. Theoretically, maybe it's a boost, maybe it's not, with clinical experience and with shadowing, with some ideas on how to get those things. I'm gonna go ahead and share my screen. As you attendees are joining, let me open up the chat here so I can see. Let us know where you are watching from, and what year you're planning on starting medical school. That is the big question. What year are you planning on starting medical school? Make sure you also change your chat settings to send to everyone and not just to hosts and panelists. Michael in Rhode Island, starting in 2024. So Michael, your application cycle is opening up right now. Canada, hello, Jacques. In the French Canada, I'm assuming. Ohio, Virginia, 2025. Ruth, another Rhode Islander.
Wow.
In 2025. 2027.
Oh.
Who's the latest one out there? Hello, Woodad in Michigan, 2027.
Good for you.
YR, awesome. 26, 27, one of those. That's Texas, great. 2024.
Whoop, whoop.
Manny's like, I don't know. I don't even know if I want to go to med school.
You tell me.
It's kind of a pain. You let me know what's going on. Cy in South Carolina or Southern California, whatever SC stands for. Awesome.
Could be either, right.
Yeah, could be either. South Carolina. There you go.
South Carolina.
I know. I like how he also puts CA for like South California, Carolina. It's an identity crisis we have going on. Are you the USC or are you at USC? That's the ultimate question. All right. So let me share my screen. We have a beautiful slide deck prepared to talk about this application, right? So we do a bunch of workshops here about every 2 weeks now, twice a month. So if you go to premedworkshop.com, you'll find all of our fun workshops that are free. So let's chat about what we're going to chat about. We're going to talk about what our clinical experience in shadowing. We're going to talk about why they matter, and we're going to talk about how to find those opportunities. So with that, clinical versus shadowing. I think this is probably one of the biggest, most confusing parts of an application for some people. The AMCAS application, and I believe TMDSAS is a little bit more specific with shadowing versus clinical experience because they're different categories. But Courtney, on a COMIS, it's just kind of healthcare experience, right?
Yep. Yeah, it's just medical experience. So you list anything within that. And so some more passive experiences will be included in that.
Yeah. Interesting. So talk about, where did my slide go? There it is. Talk about, from your point of view, when you're looking at experiences, again, from an ACOMIS standpoint for the DO application, when you're looking at those healthcare experiences, when you are, again, prior director of admissions, are you trying to parse out, is this shadowing, is this clinical, or because it was all one category, you weren't as nitpicky from the DO side?
I think directors just end up not being quite as nitpicky. The things that would really stand out to me where I would actually like remove the hours would have been like hospital volunteer front desk. Like if you're trying to count that as, you know, kind of in the room, direct patient contact facing, I would say no. I wouldn't have included that in there. So I think the separation there, it needs to be somewhere where there are patients, there is interaction, even if it's in a passive way, but anything else wouldn't fit in there. So it's more that kind of detail that we're looking at to make sure things have been logged correctly over, you know, is scribing or shadowing non-clinical. So
Yeah. Scott, when you see clinical versus shadowing, when a student's like, the typical question is shadowing clinical? What is your response to that question?
Shadowing is not typically clinical. I think that, you know, what the real key is passive versus active. Shadowing is a very passive activity. You're following the doctor around, watching things, and you're not really doing anything. Whereas clinical is interacting with patients directly related to their healthcare. So that could be something like bringing them, well, it could be things like nurses or medical assistants do, where you're taking vitals, or a phlebotomist where you're poking them, or it could be, you know, scribing is typically considered clinical, although it can often be pretty passive. So, you know, what we're looking for in clinical is you actually doing things, and things that are really very directly related to the patient.
Yeah. So big difference right off the bat, right? Passive versus active is a big part of that. Is it clinical? Is it shadowing? But then there are situations where a student shadows and they're like, hey, the doctor let me take vitals and let me kind of help with their skin biopsies and let me do X, Y, or Z. Where's that territory, Courtney?
it's in a gray area. If
Is that gray with an A or an E?
yeah, it just depends on what you're doing. You can split things apart. So if there are times when you are actively participating in healthcare and interacting with the patient, that could count as clinical. So separate it in an honest way, but you can separate. So when you are doing things, you can count it. When you are not, don't.
Yeah, I
Pretty
like
straightforward.
On the ACOMAS application, I do like, they're very straightforward, and I forget if it's actually in the application or just in the kind of instruction manual, where it's like, if there's an activity that you're doing that crosses the boundary between two different categories, split out those hours. And ACOMAS is pretty clear that, yes, that's okay. The biggest thing to avoid that you always call out is double dipping. Do not double dip those hours.
Don't do it.
Yeah, it's the proper manners at a party. You never double dip in the salsa, and you never double dip in ACOMAS, AMCAS, or TMDSAS as well.
Wait, what? You don't double dip?
Unless it's your own salsa. Like if you're a party of one, you double dip all you want.
Okay.
Don't confuse them. Don't confuse them. This is a stressful time.
So one of the, I'm still wanting to make a fun little button that I can push on my thing here.
Is it clinical?
Is it clinical? It comes up all the time. This is one of our probably most asked questions. Is I do this thing, and it's mostly students who give a title, like I am an X. Is it clinical? Scott, why is it impossible to answer a question based on is it clinical based on a title?
Yeah, because you don't know based on the title what you actually did. So if you know, I've seen some where it was a title was, you know, patient transport, or It was, volunteer in the surgical waiting room, or, stuff like that, where you don't really know what you were doing. And so you can't base it on a title. You have to base it on the actual activity. What were you actually doing in that activity? And where was it? Where was the focus of it? Were you just passively sitting there, answering the telephone, or were you actually doing stuff with the patient?
Yeah. It's always, I volunteered in the ED. I volunteered
Mhm,
X. Like, is that
mhm,
clinical? So for
mhm.
those of you watching right now, type in the box again, type 2, change your thing to everyone versus just hosts and panelists, and let us know what you're doing and whether or not, or let us know what you're doing. If you have concerns, is it clinical? Is it not? Let us know what those are.
Yeah.
YR asks, what are some volunteer clinical experience examples, ones that you do not have to pay for training? That's one of the hard things, right? Is there are some of these experiences, being an EMT, being a phlebotomist, being a medical assistant, CNA type thing, where a lot of times there are certificates that you have to get to prove that you're not going to kill a patient by taking their vitals. Probably not. And so that is already a barrier for some students, because they don't have the means to pay for those those training programs. So, Courtney, obviously you've seen a ton of applications come through and lots of different examples of what students are doing. What are some things off the top of your head that you can think of?
Like patient sitter, like in a hospice setting where you're actively helping with them care, you're helping them use a restroom, things like that. But the amount of training will vary depending on where you're at. Let's see, doula type things. Sometimes there is training, sometimes there's not.
Yeah.
A lot of scribe can be unpaid. If
Yeah.
you want to find those
Sometimes
opportunities.
you can actually pay to be a scribe. I'm like,
Yeah.
don't do that, please, my friends. Yeah.
Sometimes overseas mission trips and things like that don't
Yeah.
really take a tremendous amount of training. They take funding, but not
Yeah.
training.
Yeah.
Things like that.
Yeah, so some of the things coming in here are of physiotherapist assistant, right? A PT assistant. Clinical, right? You're kind of
Yep.
working with patients who are rehabbing. That is not in a medical setting. So there may be some question of like, is that the best clinical experience? Because those aren't true medical patients, right? So there's always a question there. But they're patients on their recovery, healing journey from whether it's surgery or injury or something. So here's one, right? U0081817 says, volunteer at a children's hospital in the ER department, right? So that's one where it's like, what did you do?
Yeah, exactly.
Right?
Yeah.
What did you do? So a lot of times volunteer means, oh, I just hung out with the families while the patient was back in the room.
Or I stocked, stocked. Yeah.
Yeah. Stocking shelves, cleaning rooms, very valuable things that obviously need to be done to take care of patients, but it's not taking care of patients, therefore not clinical. Courtney, you mentioned doula. YR here also mentioned being a doula. I think it's a great clinical experience, right? Being some sort of doula or midwife, translating, or more technically interpreting for doctors at whether it's a free medical clinic or just in general. We always get some questions of that, because that's not like, again, doing something to a patient, right? But it's that mid person in between a doctor and a patient. What do you think about that one, Courtney?
I probably would have counted it.
Yeah, being an interpreter, I think, is good. Clinical research coordinator is a very big pre-med job. What do you think about those, Scott?
Yeah, I think that is something that typically I suggest that students separate it out, because I think usually a clinical research coordinator has a lot of administrative stuff that they do, and then they do have patient contact stuff. And so I would say separate those out so that you note, 50% of my job was just administrative stuff, and 50% was clinical stuff, so that you can have two different entries for the administrative part and the. Now, if you run out of space, especially in AMCAS where you only have 15 slots and you can't separate those out, then you just have to include that in the narrative of the activity description that you were doing it, and it was partially this and partially that. So
Yeah.
it just depends on how much space you've got.
Yeah. Here's one of my favorite ones. Ginny asks, pharmacy technician
Yes.
at a non-chain local pharmacy. I focus more on one-on-one interaction with patients during vaccine clinics and medicine packaging and management with doctors and nurses. So a little bit of a unique twist on the typical retail chain, CVS, Walgreens, pharmacy technician. Maybe let's talk about both of those. Courtney, what do you think for Ginny, her specific one here?
I would say that sounds a bit more clinical, but I would wonder, okay, well, what's patient facing? Because you're talking to doctors and the clinicians and things like that. Are you giving advice, one, over your status or over your role, and guidance about medications for which you have not been trained, and how forward facing are you to patients? Like, what's that interaction there? So if not a lot of patient contact, not a lot of advice being given, sometimes you can give vaccinations and things like that. If you're not doing that, then I would say it won't qualify for the ACOMAS side, probably as clinical, either one of those.
Yeah. And this is tricky, right? Because what we're talking about is it clinical? Is it not clinical? Ultimately, Scott, the student is deciding how they want to categorize it. And then it's kind of up to each individual admissions committee to kind of adjudicate that and go, I agree, I don't agree.
Yeah.
What does that potentially look like on the back end to kind of remove the veil a little bit?
Yeah.
Is a reviewer, when they're looking at an application, kind of going through those 15 spots on a AMCAS or TMDS, ACOMAS, or Unlimited, and going, yes, no, yes, no, yes, no, in terms of I agree, I don't agree with categorization, or they're not getting that nitpicky?
I think most of the time what an admissions officer is going to do is rely a lot on the narrative that the student includes, the description of the activity, right? And they're going to look at that, and I think that admissions committees and admissions officers, I think most of the time they give the students the benefit of the doubt that the student's really trying to categorize it in the right way, and that they get it, that this is kind of complicated and there's a lot of gray. And so I don't think that they're like, oh, they're not, well, no, yes, no, yes, that kind of thing. I think they're really trying to figure out what have you done and what did you learn about it. Now if there's somebody that clearly is kind of fudging things, then that's going to affect them. But I would say most of the time, if that happens, that student may not make it to the interview stage anyway, but just because there's probably, in my experience, when you see a student that has that kind of fudging and stuff, there are other issues in the application already. And so,
what else?
Big time.
Yeah. So I want to come back to the pharmacy technician world, right? Obviously with COVID, we have a much bigger, I don't know if it was just as big before and maybe we just didn't know about it, but these vaccine clinics that pharmacies have, like if you're giving vaccines to patients, right, you're doing stuff with them. But in general, the pharmacy technician, I've always argued, is not a clinical position. It's a retail position. You're like, hey, what's your name? Okay, how many scripts? Oh, great. I go back to my basket. I get them. Confirm your address or whatever. Do you want to talk to the pharmacist? No. Okay, great. And then take some money, right? So yes, you are interacting with the patient, but we have to have some sort of logical cutoff here of that's really not clinical. Same thing, a very common position for pre-meds that I've seen is an an emergency department or emergency room registration clerk.
Yeah.
So someone is having a heart attack or whatever, right? They get brought back to a room pretty quickly, and then someone comes in with the computer on wheels and says, "Hey, great, I'm Johnny. I'm here to verify your insurance and get you checked into the hospital." And often students are like, "That's clinical experience," and I'm like, "That's admin experience. It's great, valuable experience. You're kind of learning the systems and stuff, but not clinical."
Right.
Kimberly, yeah, go ahead, Courtney.
Same thing for front desk, like at
Yeah.
a private practice and things. Yes, you're
Yeah.
talking to them about insurance and treatment and follow up, but it's admin.
Right.
Like
Yeah, so
compare it to a phlebotomist or an MA. They're not the
Yep.
same.
Mhm.
They're in different categories.
yeah. So for some of you, you're like, "But that's the only job I can get." Great, do it.
Mhm.
And like day one, go, "Hey, thanks for the job, and here's what I want to be doing." So as soon as I can start doing that kind of stuff,
Right.
let me know, right? We'll do one more here. Kimberly asks a good one that again often comes up: is delivering meals to patients in the hospital considered clinical? Scott, we'll say just in air quotes, just delivering meals.
I would say no.
Mhm.
I think that it depends a little bit on, I think often students are doing more than just delivering meals. And so
Yep.
in that case, yes, it definitely could be. But I know that my son used to do this. He used to deliver meals for a hospital, and it
Mhm.
was not clinical.
Yeah.
He would take the meal in and say, "Here's your meal,"
Yep.
set it on their tray, maybe get their tray over to them a little bit. Otherwise, that was all he did, and that was not cool.
Yeah. But if you're delivering the meal and sitting with the patient and maybe feeding them,
Right.
right,
That's
then
right.
we're getting back into, okay, yeah, that's different,
Yes,
right? So this
that's
is
correct.
where we can't just ask high level. We have to get super nitty gritty with, well, what exactly are you doing when you say that's what you're doing?
Hmm. Hmm.
All right, let's get back to our presentation here. Let me find it on my screen. All right. So, how do you find clinical experience? I think this is the biggest. My mouse is going crazy. This is the biggest struggle that I
Mhm.
think students have with this process, is finding those experiences and understanding, hey, I don't know where to start, right? Where should a student start? Courtney.
Maybe their own physicians that they're going to see, their primary care provider, and build from there. A lot of physicians know a lot of physicians, right? And so they might know if somebody allows students to help or shadow, or you know what, you should check over here. You can talk to people at the hospital. A lot of the times, if it's not a private practice, like if it's in a hospital, HR will have something to say on whether you can or cannot be in there to do certain things. So, the doctor may tell you yes, but then there's going to be follow-up measures that are going to have to be followed. Checking your state's registry for licensed physicians in the area, just to get a grasp and kind of scope of who's actually available and maybe some areas of interest that you might want to do. A lot of it is hustling, right? You have to be your own biggest
Every day I'm hustling.
advocate, right? Yeah. And it's not going to stop. Once you're in med school, a lot of the times when you're getting audition rotations, guess what? You're doing that on your own. And so this is a good time to practice that. Be your own biggest advocate. It's going to take a lot of phone calls, a lot of drop-in visits, a lot of dropping off your resume and things like that for a lot of people. And that's okay. They should know about that. But start within your network if you have one. And if not, through clubs and organizations, they may know people. Talk to your pre-med advisor. They may know about people who have in the past let students shadow, scribe, do training. They may be a really good resource for that and pointing you in a direction. And then when you talk to physicians, ask them if they know of any other ones that they could suggest. Build from there.
Yeah. So I'll add a disclaimer to what I'm about to say. I just met one of the founders of this company this past week at a conference. She's a physician herself. It's called capyear.co, cap as in like gown and cap and gown. Capyear.co is a company that has relationships with hospitals and doctors' offices to place students in. It's actually something that we've talked about creating as part of Mapped, but this person is doing it with Capyear, so you can go check them out. Again, we don't have any relationship with them. I haven't had any feedback from any of their students, so take that advice with a grain of salt. But you can check them out, capyear.co. Scott, do you recommend a student jump into, as we saw earlier, I think it was YR that was like, what can I do where I don't have to pay for training? Now, there are a lot of things that students will pay for, right? Whether it's a medical assistant certificate, CNA certificate, phlebotomy certificate, stuff like that, EMT training. Should a student jump into those things without a job on the back end, or should they start looking for jobs first and then kind of get some sort of commitment or buy-in from a clinic, a hospital, et cetera, that says, yeah, great, go get your training and we'll hire you on the back end?
Yeah, well, I think what I would say is that I think you want to get the lay of the land first. You want to sort of figure out for your community, for your state, what are the requirements for these various things, an MA or a patient care tech or a whatever, EMT, et cetera. And so find out for your state what the rules are, and then get a sense in your community of what things are available, what are readily available. You don't want to go do a medical assistant program to get that certificate and then there's no medical assistant jobs available. Yeah. You want to really get a sense of what's out there, because there are some clinics, some private doctors' offices that will do your training for you, depending on what state you live in and stuff, where you don't have to pay for training. They will do it. So it depends a little bit, but I think get the lay of the land, figure out what's available, what the rules are, and then you'll know how to sort of move forward. And you'll this is a good advice for really anything that you're doing in life. Is you want to be as fully aware of the ground rules and of the lay of the land before you launch into going and doing something that's going to require you to do a lot of studying or pay for a program or things like that.
Yeah. Great. I wanted to go back just for 1 second, kind of when we were talking about, is it clinical, is it not? A very common question Amy asks is, how would you divide EMT time potentially? Because an EMT has a lot of downtime. They're not always with a patient, always doing something clinical. Courtney, is that something where you're super concerned about, like, every minute has to be tracked? Are you with a patient or are you not?
No, I'm not gonna parse hairs on that one.
Yeah.
Now, if you're claiming a number that couldn't even exist, like it's clearly fictitious, then there's a problem. But if you're having to clean out the back of the ambulance in your downtime and do all of these things, I'm not gonna spend my time doing that.
Yeah. Right. I always, when that question comes up, I always point to a study that looked at, I think it was Hopkins residents, interns, first year residents, how much time they actually spent with patients. And it was only like 11%. It was disgustingly low, how much time the interns actually spent with patients. The rest of the time was rounding and charting and other important things, right? You're doing grand rounds and all that kind of fun stuff. But you wouldn't say, oh, that doesn't count as doctor time, right? It's important time. The one potential caveat is, if you're working a 24-hour shift, don't count the time you're sleeping, right?
Right.
And if you're like a medic in the military, do not count your math as 24 times 7 times 52 times number of years, right?
Right.
Just do normal 8-hour days,
Right.
5 days a week. So for a typical full-time military person, the normal 2,080 hours a week is probably what you should put. Yes, again, as a veteran myself, we know you're always on duty, all that fun stuff, but don't do that fuzzy math.
Yeah.
And same thing for medical mission trips. You're not working the entire time that you're there. So please condense it down to realistic, actual worked numbers. Any type of mission, even if it's proselyting, like condense it down, be accurate.
Exactly.
So we don't have to do the math for you or think that you're lying.
Yeah. Again, as you mentioned earlier, Scott, of like, if you see some of that fuzzy math, then it's going to kind of raise a little hair of like, oh, well, you don't have any hair, but
what?
Raise a little hair of like, what else should I be looking a little bit closer at to potentially think something's going on here in terms of fabricating some evidence. Yeah. So be careful with that. Yeah. All right. Shadowing opportunities, I think even harder because for clinical experiences, a lot of these positions are needed, right? We need someone to sit with a patient. We really want someone to be with a hospice patient. We really need someone to draw blood and be an EMT and all this other stuff. Being a shadow is more of a nuisance than anything else. And so it's much easier for a hospital system or a clinic or specific physicians to go, get away, kid, you're bothering me, which pisses me off because I'm like, you were once that pre-med student. Why can't you just help a little bit? Scott, do you have any secrets for finding shadowing?
Well, I don't know how secretive they are, but I think as the slide here indicates, you use whatever networking you have available to you. If there is somebody in your family that has any connection to healthcare at all, if they're a nurse or they're a patient care technician or they're a PA or anything that's related to healthcare whatsoever, even if they're a billing clerk at a clinic or something like that, use those networking opportunities to say, hey, could you Aunt Susie, I know that you're a billing clerk at this such and such clinic. Is there any way that you could help me sort of, get to meet the physician so I can maybe try to shadow or something like that? So I think that's a very important place to start. Now, a lot of people don't have anybody in their family or their social circle that is connected to healthcare, and there's a lot of cold calling that happens. I think the valuable way to do cold calling is not through the telephone and is not through email, but is actually get your butt out of your chair and go to the clinics and take a short, one-page resume, tell them what you're there to do, and I think a really important part of this is offer to do things that they do need to have done. If you go in and you say, look, I'm willing to do anything, to volunteer to do anything that you guys need to have done. I'll file stuff. I'll empty the trash can. I'll mop the floor. I'll do anything if you'll let me follow the physician around for a couple of days. So what that does is it shows not only that you have a great amount of initiative, but it also shows that you're willing to do things that they need to have done. And
it makes it more of a two-way relationship and not just give me.
Yep, absolutely. It shows that you're willing to give them some value in addition to you getting the value.
Yeah, I think that's a huge skill and tactic that a lot of students don't use. Whether I think maybe getting a little politically incorrect here, the pendulum of kind of how we treat kids and how we get a little too coddling. Like, we need to go out and say, I'm willing to do anything and everything. I think too much stuff is expected to be handed to people these days. So I like that tactic.
Well,
go ahead.
And emails are so easy to delete and ignore.
Yep.
it's just not really going to do anything. And most of the
Nope.
time it goes to the practice manager. And if they think it's like one more thing to add to their plate, they're going to be like, no,
Yep.
didn't even come in. I don't know if this person's weird, right? Like, do they have any social skills? So it's really important to go there, dress professionally, look nice when you go in,
Yep.
and find those opportunities. But in person, I think Dr. Wright is spot on. It's going to open so many more doors than just emailing 100 people. You can
Yeah.
delete that so easily.
Yeah.
Yeah,
And I would
go ahead.
Oh, go ahead. Go ahead.
You
Ryan.
go. You go.
Well, I was going to say, if you're a current student at an institution, I would say even get your pre-med advisor to write you a letter to say, yes, this person is a pre-med at this institution. It doesn't have to be a long letter, just a short little snippet that says, yes, they're pre-med here. They're looking for opportunities to shadow physicians. So it validates for the clinic that you are who you say you are and that you're legit. And it may not, it may not be the nail in the coffin that you need it to be to do that, to be able to get a position to shadow, but it could help.
Yeah, it could help. I like that little co-signing, basically. Like, I'm not just some stranger coming off the street.
Yeah, right.
One other potential thing to do, and again, disclaimer, I have no affiliation with them, but one of the biggest arguments that clinics and hospitals will say is, oh, HIPAA, right? Patient privacy, which 1,000% is very important, and I take HIPAA super seriously. But there are ways to get your HIPAA training for very inexpensive. It's like $20 at HIPAAtraining.com, I believe is the website. Again, no affiliation with them. I know some medical schools use HIPAAtraining.com as their HIPAA training kind of service to get their students HIPAA certified. So it's potentially one way, from a sales background. One of the things that we always talk about in sales is overcoming the obstacles, right? Or overcoming the no's. One of the biggest no's is HIPAA. Because of HIPAA, we can't. Well, actually, look, I'm HIPAA certified, right?
HIPAA-fied.
I'm HIPAA-fied. HIPAAfied.com. I'm going to get it right now. I love it. Don't beat me to it, people. I love it. So that's one other thing potentially to say, hey, I'm looking for shadowing. Here's my HIPAA certificate. Here's a letter from my pre-health advisor. Those are great.
Yeah.
YR asked a question. How can we track all of this stuff? Well, good news.
What?
Mappd.com is 95+% free to track your courses, track your activities, track your MCATs, have discussions with your pre-med advisor. You can invite your advisor to have access, read-only access to your stuff. One of the big things that we do with Mappd is helping you understand that it's not just total hours. It's not just stats. It's what are you getting out of these experiences? Dr. Wright, what's your favorite saying? It's not the
what, it's the so what.
That's it. So when you're tracking your hours, there are reflection boxes to kind of type what happened that day. What did it mean to you? What emotions did you have that day or that week as you're going in? Kind of we think kind of on a weekly cadence, going into Mappd and updating things that you did that week, so that in a year or two, or for some of you who are applying or starting med school in 2027, you'll have that information at your fingertips, all with everything else, right? Your courses, your activities, your MCAT scores, your med school list, your letters of recommendations, which is a paid feature as part of Mappd Pro. So go check that out at mappd.com. Let me, when we get to the Q&A, I'm going to take 2 seconds and create a special coupon, like a referral code for you all to get 90 days of Mappd Pro free. And that will allow you to go in, create your account, and then for 90 days, you'll have access to our paid level, which will let you chat with our advisors. So within Mappd, there are a couple paid things right now. Chatting with our advisors directly in the platform so that you can say, hey, I entered all of my grades. I have some concerns about my trend or concerns about my cumulative GPA or science GPA. You can go and ask, and we'll go take a look at your stuff and give you some feedback. You can also use my LORs for those 90 days. You can, we have mapped mail coming out next week, I think, which is a cool new feature that we'll talk about a little bit later. But don't sign up right this second. I'll give you a coupon code for it. Awesome. You're welcome, Olivia. That's what I'm here for. For those of you who are early on in your journey, Courtney, talk about pre-med pathway.
Yeah, so we understand that not everybody is applying for this next upcoming cycle, and not everybody has access to an undergraduate pre-med advisor. So we can backfill that role. So all of us have experience actually also advising at an undergraduate level to get you prepared to apply to medical school. So if you want to use us for that, and we can kind of help you be strategic in setting up your coursework and talking to you about timing for gathering certain experiences and being just really thoughtful and strategic. That's what this is there for. We saw a gap and realized that some people just don't have access to pre-med advising in a way that's going to be really helpful in tracking your journey. So we can do that. We have experience doing that. We're happy to do that for people that are interested. So that's why we built pre-med pathway.
Yeah. I just created that referral code. That's how easy it is. Mapped is even easy for us admins. 90 days free using that link. It is for new accounts only. So go create your account and use that code workshop. I'm super excited about stuff we have coming for Mapped. Complete new redesign, making things even better. Scott, one of the things we also do day in and day out is working with students one-on-one. Why should someone sign up? Because it is quite an investment. Sign up to work with us one-on-one.
Yeah, I mean, I think there's a variety of reasons. One of which would be if you're, and this is a very typical reason for a non-traditional student. They're not in school currently, or they've already graduated or whatever, and they don't have access to a pre-med advisor. And so they're sort of feeling out alone, and they need access to somebody who can answer their questions, who can read their essays, who can evaluate, whatever they're needing to do, who can do mock interviews and help them in interview preparation. So that would be a very important reason why you might seek out assistance. And another reason that's indicated on the slide is this, maybe maybe there is a pre-med advisor at your institution, but there's also 50,000 students at your institution, and the pre-med advisors are just overwhelmed. And so you may want, to do it for that reason. So I think there's a lot of reasons why somebody might want to meet with us one-on-one. If no other reason, to give you peace of mind. Maybe your pre-med advisor gave you some advice and you're like, I don't know about that. You could have just a 30-minute session with one of our advisors and say, hey, this is what I was told. It sounded weird to me. I just wanted to check it with you. And see what your thoughts were, stuff like that. I think it's very helpful. We get a lot of students who want us to read their essay, whether it's personal statement or some other essay or whatever, and get our response to it and get us to help, give them feedback on that. So that's another important part of what we do in those sessions.
Yep. I just posted a link. medicalschoolhq.net/advising is a link that will show you all of our advising options for you. Again, a lot of what we do is free. We do these workshops, we do podcasts and videos. So go check out all of those things. And then for a lot of you, some of you, you may want to engage us in a little bit of a deeper one-on-one relationship. So go check those out. And now it is time for some Q&A, the favorite part of this time. For those of you who are watching, raise your hand because this is a webinar. You won't be able to turn on your video, but I can allow you to unmute yourself. So if you have a question, raise your hand. All right, let's go with Jean Saint Pierre.
Hello, everybody.
Hello. Bonjour.
Bonjour, bonsoir.
What's up?
So I got a great question. I was in the army. I used to do urinalysis a lot for like my entire 4 years. Would that count as clinical?
What were you doing for those 4 years?
Urinalysis.
Urinalysis.
Oh, urinalysis. So more like a lab tech.
Yeah, because I collect the specimens and everything like that, update the records and stuff,
Yeah.
and then I ship it to the lab. So I was curious about that.
No, it's the same question whether you're doing urinalysis or again, kind of lab science people who are actually receiving the vials of blood and putting them in the centrifuges and stuff. Definitely a super important part of the medical process, but not clinical experience.
Understood. And you know what? Since I'm on secondary question,
Yeah.
and I also volunteer with a clinic here in San Antonio where we do called Armreach, like drug reduction, where we provide wound cleaning. We clean the wounds for homelessness and provide fresh needle and education how to keep the wound clean. Would that also count as clinical?
I would count that as clinical. Yeah.
Sure.
Okay.
Sure.
Okay. We see a lot of patients like on a day, like 2 hours. We see at least 25, sometimes 30 homeless that
That's
do a lot
great.
of stuff like that.
Yeah.
So
It's awesome
perfect.
work.
It's a great service. Yeah.
Yeah.
Thank you. Appreciate
You're
you
welcome.
all.
Of course. Thanks, Sean.
Grace, hello.
Hi, how are you guys doing?
Wonderful.
Wow.
So my question is, I did, it was more of an ethnographic research about, and it was in anthropology, and we interviewed ALS patients and their families kind of about the illness experience. ALS is like, it has a lot of disparities. So yeah, I was wondering if that would be clinical.
I don't think so.
Two of us shook our head pretty quickly. Courtney was like, What do you think, Courtney?
It depends on the platform. I would say I agree on the AMCAS application, no on the ACOMAS application. Conducting the interviews to gather medical information probably would be. So I think it's going to depend, and it's kind of in that gray area with an E.
Yeah. Why not, Grace? Why not categorize it as research if that's what you're doing?
It just felt clinical because we were coming to the patient's homes and we would visit them multiple times and form relationships. So I think that's why I in my head I considered it clinical, but yeah.
Okay. Yeah.
Yeah, and I think that's a good example of you making the case for what you think it is.
Yep.
And the medical school can either agree or not agree. But if you're making a good faith effort to identify what you're doing and what it was all about to you and what you learned out of it and sort of the details of it, then if the medical school doesn't agree, then that's fine. That's their role. But you categorize it for how you think it is, if you're being reasonable. And I always say for things like this, be prepared perhaps that in an interview that might come up. They might say, I see that you indicated that this particular activity was a clinical activity and it doesn't, sit with me quite well. Let's talk about that. And if you're able to talk about it and make a convincing argument for why you considered it to be clinical, then that's great. There may be a dialogue on that and they may agree or disagree, but the dialogue is very important and I think it could be valuable. And so, but make a good faith effort on your end to identify what you think it is and really put some effort in giving evidence for what you think, and then let the med schools do what they're supposed to do.
Yeah, and if it boils down to them not counting it as clinical, do you have other things that are very clear and obvious clinicals where it's not in that gray area, right? Because then, no matter how they categorize it, you're okay. If you were really depending on this to carry a bulk of the weight for your clinical, that may be a little bit problematic. And so, you may want to seek out a couple of additional opportunities or something like that. So as long as you're covered in both categories, it doesn't matter how they end up categorizing it, if they side with you or not. And really, it would only be a problem if there's a huge deficit then in your clinical experience, since you put everything into that.
Sure. Thank you so much. I was wondering how many hours of clinical experience would be competitive. I know that that's probably common.
400,000.
Oh, I thought it was 400,022.
Yeah, no, that's yeah.
Anything above 0 is good.
Yeah.
And it will depend upon the rest of your application. Like if you are taking 15, 18 credits of upper level science and you have a part-time job, obviously your clinical experience is going to be lower, rightly so. If you are taking 12 credits, you don't have a job, I'm going to maybe expect to see a little bit more since you have hours, or can you just not balance a lot of things at once? So nothing is in a silo. It's going to depend on that, but anything more than 0 is beneficial.
Yeah, the thing I like to say is recency and consistency to me are more important than total. So if a student has 1,000 hours from 4 years ago versus another student who has 100 hours but is doing 10 hours a month or so over the course of a couple of years and still doing it, and it looks like they're going to continue it through the application cycle, those are two very different stories that are being told.
Yep.
All right. Thank you so much.
You're welcome. Christian, hello.
Hi, guys. I had a quick question about how I should put my research position on my application. I started working in this research lab, excuse me. I started working in this research lab in high school, or volunteering in this research lab my sophomore year of high school, the summer of my sophomore year. And then I took a huge break from that, just like focusing on high school. Obviously wasn't like super into it. And then I realized I actually had a little bit of a knack for it. And so I started the research lab up again when I ended up going to the same college that I was previously working in that research lab. And then I volunteered for my whole freshman year. And then I got a paid position in that same lab that following summer, and then started doing presentations, etc. And I don't know how to do I separate those two experiences as volunteering and then paid position? Or do I just label it as paid position, or just research paid, research volunteer? I don't know how
I would go for the highest level that you had, and then indicate in the narrative that you started as a volunteer, and then that you it developed into a paid position. So I would start with or indicate the highest level that you got to, and then kind of tell the pathway that got you there.
Okay. Awesome. And then I also had a question about publications and presentations. Do those go under the same section, or do I talk about the paper that I wrote separately than the presentations that I did at different schools? Or does that all just go under a list of presentations and publications?
Courtney?
Don't right.
It's different on the application services. So you will just have to follow the instructions for each one because it is different and it's laid out pretty clearly. But
okay,
you're going to get 3 different answers.
Yeah.
Okay. Thank you, guys. I appreciate it.
Yeah, for sure, Christian.
Yep. Ruth asks a good question that I'll ask now about getting clinical experience while outside of the US. So this comes up a lot, whether it's international, like structured international shadowing or international clinical experiences, or for students who lived outside of the country for any part of their life. Getting clinical experiences, getting shadowing, or we even have students who started medical school in another country. Does that type of stuff count? Scott, what are your thoughts on international experiences for the application?
Yeah, I think they can be very valuable. I think you can learn a lot about healthcare in that particular area, that particular country, and I think it's always valuable to if you're doing that sort of thing, to compare it as much as you can with what the realities are in the U.S. and what the realities are in that country. That's one thing I would say. Another thing I would say about it is, do not absolutely do anything in the foreign country that you would not be allowed to do in the United States.
Yeah.
So even if the doctor's like, here, hold this forceps, and hold the heart over so I can get to this other thing, and no. You can just say in a nice way, I am not comfortable doing that. Because that will happen. There will be doctors that will say, here, do this or do that or whatever. And even, if in a weird circumstance you do something like that, do not mention it in your application. That is not something that you want to talk about. I think often pre-meds think, oh, this is going to really impress the admissions committee because I held the forceps and I can tell all these cool things about what I did and everything. And that can be a real red flag.
Yeah. The AAMC is trying to crack down on that. I had a student literally a week or two ago talk about what they were doing internationally. I'm like, do not talk about it. Don't say that ever again. Right. I don't want to know about it. Yeah. I don't want to be a party to that. So be careful. The big thing though is a lot of times students will shadow overseas and have nothing here. And one of the biggest reasons to shadow is to understand the day-to-day life of a doctor here, right? What is the healthcare system, as screwed up as it is? What is that here? What does that day-to-day life look like? So that's an important part of why you should also get shadowing here in the States. Sai.
Hey, can you hear me?
Yeah.
Okay. So my question is, my first 2 years of being in college were affected by COVID. Like I'm sure many people in my situation, they were also affected by COVID. So because of that, there wasn't really much volunteering opportunity. Like the local hospitals near the university, they weren't allowing anybody, to come in or anything like that. And only starting my junior year, the year I'm in right now, they started allowing it. And I right away got into volunteering. But my question is, I think they recently added it on both application, the AMCAS and the ACOMAS application, about like talking about disadvantaged things that include that. But would I want to include the COVID, like an essay about COVID, explaining how that affected my volunteer hours, or do I just need to suck it up and like get a bunch of hours, or do I just like ignore it and they will understand that it's a weird situation?
Well,
Courtney, yeah.
From my perspective, I think as we get farther and farther away from it, things will start kind of going back to the old views, which is suck it up and get some experience because it's out there. Are they going to be really mad that you don't have anything freshman or sophomore year? Probably not, but they're going to expect you to have stuff junior and senior year or a gap year. So I would say do what you can within the time frame that you've been given. They'll be able to see the dates. They'll kind of know what was going on without you having to write about it in great detail or give any type of like excuse or justification for it. What's really going to matter is what you do going forward, and whether you want to write about it or not is completely up to you. But I'm anticipating that there's going to be less and less leeway for people saying, I just couldn't get anything, because you could at this point. So that would be my takeaway.
I have some like volunteering. I immediately got volunteering and shadowing at the beginning of this school year. So like as soon as I could, I did. But I just didn't want, I wanted to make sure, because I know there's some people that have been doing it since freshman year, and I literally couldn't.
Yeah. They'll see the dates. They'll know what was going on. They're not going to hold you apart from that, but they probably won't give you much latitude if you only relied on that and never did anything. So it sounds like you're doing the right thing.
Yeah. All right. Thank you.
Yeah. Sure.
Big fan of your the mission accepted, by the way, Dr. Gray.
Woo! Awesome. Thank you. All right. Norwin. Hello.
Hi, can you hear me?
I can.
Perfect. So I had a question about a clinical role that I have, which is also kind of like includes shadowing a little bit. So I'm a medical assistant, but I don't have like a lot of the administrative roles. Um, uh, when I went in as a medical assistant, but it was mainly like the doctor took me in as like a more of an intern. And so my role is like taking history, doing like X-rays, ultrasounds, imaging. Um,
Sweet.
and doing a lot of that kind of like preliminary collection of data, I guess you can say. And then after that, I go grab the doctor, and then we go into together to see the patient. And so essentially, I'm doing all the clinical stuff, but I'm also shadowing the doctor. And then afterwards, we also come together, and she does her notes, and I help her with that. With anything that I remember, I ask questions. So I was wondering, should I separate my kind of roles as shadowing and clinical, or should I just put it together into one?
I'd put it together.
Yeah, I agree.
And would that be applicable for both the ACOMAS and the MCAS application, or?
Mhm.
Okay,
Yeah. Mhm,
thank you.
mhm.
All right. Hello, Ruth.
Hello, can you hear me?
Mm-hmm.
Okay, so I was the one asking about the international experiences and things like that. I was wondering, because I forgot to add like a little story about behind it. I went to high school abroad, and as part of the program, I went to like a nursing technician school. So as part of the training, I was allowed to like give shots to patients, start IVs, and like things like that. I know Dr. Wright advised to not include things that you wouldn't do in the US, but I had training abroad to do that. So I was wondering if I should do that, and two, if I should include it because that was like almost 10 years ago.
Well, the first thing I thought I heard you say that was high school,
Mhm.
Yes.
and you don't put anything that was high school. It's all after high school and forward. Nothing you
Okay,
had,
perfect.
nothing you had in high school is relevant to the process.
Okay, perfect. And also, I had another question. I work in a big teaching hospital now, and they do lots of grand rounds with doctors and things like that. Does attending to those count as shadowing, or it doesn't count as anything?
I don't think so.
Okay, thank you.
Mhm.
Jacques from Canada.
Okay, hello, can you hear me?
Yep.
Hi, how are you guys?
Doing well.
Great.
Good. I have a question here. So I'm a Canadian applicant hoping to apply for the States.
Mhm.
So my issue is getting the physician shadowing hours.
Mhm.
And Ryan, you said earlier, what was it? It was something about you should be getting these type of shadowing hours to understand what it's like to be a physician in that state, right?
Mhm.
So, and I do want to live in Cali. I guess what I'm trying to say is you get to surf and ski in the same day, which I do like that aspect. so it's with the lifestyle. But my question is, should I be going to, let's say, Cali, and then doing some sort of shadowing down there if I want to, practice medicine and do med school in Cali?
So
Yeah.
Cali is
Scott,
a hard nut to crack.
it's
Yeah,
yeah,
sure
for
is.
anyone.
Sure
Scott,
is.
I'd be interested in your thought with this because just in general, the Canadian applicants, it's much harder to find shadowing. It's much harder to get clinical experiences. Canadian schools do not expect their pre-med students to do these things. Right. And if Jacques comes from a place of means where it's like, yeah, sure, I'll just jump on a plane and I have 10 physician friends that I could potentially go reach out to. Like that's right, the haves and the have-nots. What do you think the expectation is from US med schools for Canadian applicants to get these experiences that typically aren't expected up north?
Well, to be bluntly honest, I would say there are so many applicants to medical schools in the US, they're not going to have a different standard for you. They're not, for Canadian applicants, it doesn't make any sense for a school to say, oh, well, they're Canadian. So, well, okay, we get it.
We have a different rubric for you.
Right. No, that's not
Yeah.
going to happen. Yeah. So, you're going to be expected to meet the same, expectations that every other applicant is going to be expected to have.
Yeah. And there's still plenty of Canadians getting into US med schools.
Oh, absolutely.
We work with some.
Absolutely.
I had one a couple years ago who got an interview at like University of Kentucky, like a public school. And they're like, why are you applying to us? You live in Toronto. And she's like, oh, my uncle lives in Kentucky and I go and visit him every summer. And they're like, cool, we like you. Come interview.
Yeah.
So it's just going to be so school dependent.
Mhm, mhm.
Yeah, totally. My idea is, if I'm going
He
to
already,
the
he already
States, I'm
talks
paying
like a
international
California kid.
fees.
Totally, dude.
Totally stoked.
I mean, I
great.
did spend, I think, a month in LA. So, but yeah, the idea is to apply for the States and then, only the top schools because international fees are crazy,
Mhm.
And so, I've expected, going to the States really hard. So I've saved up a couple dollars here and there, to the point that I can probably survive in
What
Cali
is
for a little bit.
Jacques? I want to pick apart what you just said there. Only to top schools because
Mhm.
of international fees. What does one have to do with the other?
So I guess what I'm saying is like the tuition, right?
Well, yeah, I understand
If
that,
I'm
right?
going abroad,
International tuition
yeah.
is hard, but what does top school have to do with anything? What does that even mean?
Honestly, I don't
You
really
hit a
know.
sore spot. You hit a sore spot.
I think I did, yeah.
All right.
I mean, my
I'll have you
main
ponder
goal
that
is
some more.
Stanford. Yeah, my main goal is Stanford, and the reason I want to go to Stanford is because I'm business oriented. That word,
Yeah.
and they're top, one of the top schools for medical education. Sorry, and then, but not only that, I'm also doing a research project right now with for an industry sponsor up here in Canada, who is also doing a, I guess it's a multi-sited research,
Mhm.
and Stanford is one of them. And so
Okay.
I'm thinking like, oh, I have these three checked boxes, I guess, filled.
Yeah. Okay.
And I
Yeah.
think Stanford is a good school, right? But it's
Yeah,
just
sure.
like
There's
it's really
no reason to
expensive
not.
and
Yeah.
Yeah.
Go for it.
Yeah.
Mhm.
Shoot for
Now,
the stars.
Now,
Land on the moon.
Stanford's
Okay.
it's a new school, right?
Yeah. Yeah.
Yeah, I think so.
Yeah.
Very cool.
All
Well,
right.
thank you so much.
Thanks, Jacques.
They accredited?
I think they might be on probation.
Yeah.
We're friends with their
joking.
director. You can't say that.
It's satire. Satire.
She would be sad.
All right. No one else has their hands up. If you have a question, raise your hand. We'll bring you on. So Jaquata asks a question. I was a CNA for 7 years, but stopped in 2019. So this is kind of that recency consistency thing. Full-time student, work, and mom. Should I do a few hours of clinical volunteering to show consistency? Or is my work experience as a CNA enough?
More.
More. Yeah.
Need recent.
Consistent. It's hard, right? Because yes, you're a full-time student, working mom. And here's where I think oftentimes students have this like all or none expectation of like, oh, you're telling me I need more clinical experience, so I have to go get a 20-hour-a-week job. I'm like, no, like 5 or 10 hours a month is probably good enough. Just something to keep wetting that whistle a little bit, so to speak.
Absolutely.
Yep.
A Kumar. Not the Kumar, just A Kumar.
Hey, Kumar.
Hello. Hello, hello.
No, Kumar.
Hey, Kumar. Goodbye, Kumar. Anyone else? Michael. Hello, Michael.
Hi, can you hear me?
Yeah.
Awesome. Thank you for this opportunity to ask my question. I actually had a question with regards to a volunteer experience that I had the summer of 2020 as a COVID-19 screener, where a lot of my position was gauged towards asking CDC questions for patients and visitors, and also escorting patients throughout the hospital if need be, whether that's walking them over to different parts of the facility or escorting them by wheelchair. And I kind of wanted to gauge if it was truly a clinical experience or look for opportunities that are more like clear that, yes, this was clinical.
Scott, what do you think?
You know, I think that this is a question that's going to be raised a lot for the next couple of years as applicants who went through COVID are applying. And I would say I would probably, if it were me, I would probably say it's clinical, and you know, that was a part of the care for that patient in terms of getting their COVID you know, results and helping them understand the rules regarding the CDC and stuff like that. I'd probably categorize it as a clinical activity.
I would have said the same thing.
Cool. There you go, Michael.
Awesome. Thank you so much. I really appreciate it.
Yeah, you're welcome.
Be safe in the car.
Yeah, right.
Lower hand. Aman.
Hi, can you hear me?
Yep.
Awesome. So I had a question about one of the volunteer opportunities I'm doing. So in that organization, I would be working with Alzheimer's patients and their families, and it's nothing like big. It would just be like, you know, talking to them, having activities and that kind of stuff, just like a social event, 4 hours a week, that kind of thing. So I was just wondering, does that also count as clinical experience, or is that more volunteering?
Well, I think you got to keep in mind that clinical can be volunteer, so you could categorize it either way. But yeah, I would see that as clinical, especially with an Alzheimer's patient, because you know, Alzheimer's is the kind of dementia, Alzheimer's, those sorts of things. They're neurological or psychological. Well, not really psychological, but neurological conditions. And so talking to the patient, keeping them cognitively, mentally engaged is definitely a part of their healthcare. And so I would say it's clinical.
Agreed.
All right, and I was just wondering what your opinion is on like volunteering for a crisis text line, because I've heard like differing opinions about that, if it's clinical or not.
Yeah, it's one of those unique ones that kind of existed before COVID and then became a little more popular during COVID.
Mm-hmm.
My stance, I would categorize it as clinical. It's telehealth. You're interacting with these people who are in the middle of crisis, seeking help. Obviously, you're not doing things to them, but you're there to support them. So it just happens to be through technology.
Yeah, I agree.
Okay, awesome. And sorry, just one last question. So a student earlier mentioned how like she was interviewing patients and for research and whatnot, and you guys were saying it's more so research experience instead of clinical, which I completely understand. But at what point does research become clinical research if you are interacting with patients? Like, do you understand what I'm trying to say there? Like,
What's the key?
Classify it as clinical.
Yeah, the key is what you just said. The key is, were you interacting with patients? If you were interacting with patients directly related to that clinical experience, that clinical trial, for example, or whatever, then it's clinical.
Okay, so like interviewing them, for example, in that situation wasn't clinical, but if it's like related to like, oh, we're trying to like make sure you're okay with this treatment and you're just like going through like a questionnaire with them, would that be okay?
I don't know about that.
See,
Alright.
I had a different view, right? So I think you're going to get a little bit of both, right? And so that's like Dr. Wright said, do your best to try to categorize it, advocate for yourself on what you were actually doing. You were the one that lived the experience, so categorize it that way. You know, if you were taking vitals or collecting specimens and things like that as part of the questionnaire, like that makes it a little bit more clear. But if not, then, you know, it'll all be okay in the end. As long as you are trying to be careful and thoughtful with it, we'll understand that. So
Mhm.
maybe one that we don't agree with the categorization will not be the end of the world. Now, if you are all over the place or double counting or really having a lot of mistakes and things like that, then it's problematic. But these ones that are truly kind of hard to define or categorize, as long as you're being thoughtful, it will be okay.
Yeah, and it's as I said earlier, I think most admissions committees are going to pay a lot more attention to what you're saying about the activity,
Sure.
the narrative that you're providing, than the category.
Yeah,
They're
absolutely.
really going to focus in on that part.
Yeah.
Awesome.
Yep.
Thank you so much.
Yeah, I meant to mention this earlier as well for students who maybe have a great clinical position as an emergency room volunteer as the title, but they're doing things that are clinical. Don't in that description then talk about for 3 sentences all of the non-clinical things you're doing about stocking shelves and changing the beds sheets and stuff like that. Like, again, we understand there are plenty of non-clinical aspects to almost all clinical jobs. You don't need to focus on that.
Yeah.
Hey, Kumar is back. Can we hear you now?
Can you hear me?
Yay!
Yay!
Finally. Sorry. Actually, I'm a parent and my son is writing an exam, so he sent his questions. So,
Thank you for
Awesome.
supporting him.
Absolutely.
so his question is like he's trying to get shadowing hours, and at the hospital, wherever he's trying over here, they don't allow more than 3 days to shadow. Is that enough for each discipline, or should he try to go back and get some more in the same specialty?
Better than nothing.
Yeah.
So 24 hours, like 8 hours a day, 24 hours in one specialty like surgery or cardiology is good.
Mhm.
It's good for that location, right? If he can end up getting more in the future somewhere else or doing something else, that'd
Yeah.
be great.
Mhm.
But you know, some resources will come with stipulations, and so
Yeah.
follow those stipulations. That's what they have set, and you may have to search just a little bit broader for additional opportunities in the future.
Yeah, the
Oh.
one thing I like about that situation is it gets his foot in the door, and then
Mhm.
the physician he's shadowing, that
Yes.
physician may also have a clinic outside of that hospital system where that physician's like, yeah, you can only shadow 3 days here at the hospital, but come to my clinic anytime you want. Or, hey, doctor, do you have a buddy where I could also shadow and maybe shadow more often? So I think that's where once you have your foot in the door and you show that you're kind of not a nuisance, and they're like, oh yeah, you're not that bad to have around, then they're more likely to want to help you out.
So ideally, how many hours should he focus for each specialty?
There's no number.
Mhm.
Okay, so whatever he can do is, and whatever.
Recency, consistency.
Yeah.
Okay, okay. Thank you for answering that question. That's all I
You're
had.
welcome.
Okay.
Yeah, for sure.
All right. We will dub you the Kumar now. Arthur. Hello.
Hello. Thank you for giving me the opportunity to speak. I do have a question, but I would have asked this sooner, but I just could not get over the anxious feeling that maybe everyone here like already knows this, and it's just it becomes extremely difficult for me to ask these questions. So the trivial question being, is there a difference in terms of priority in the case of like shadowing, research, and clinical? So when you're applying to med school, is there like the ones like prioritize over the other? Let's say clinical, like if you have more clinical experience over like, let's say research or shadowing, is it seen as in a better way as opposed to like having more research instead of clinical?
That's a great question.
Yeah.
Not a bad question.
This is all the rubric, Courtney.
Yeah.
Do you think a lot of schools have similar ideas on this, or do you think it's going to be individual?
Well, one's required and one's not by most schools. So
Yeah.
clinical
Required
will,
in air quotes.
yes, yeah. I mean, clinical will probably trump the other two most times. You know, having shadowing is still, I think, kind of an expectation. So I think it's good to have. Having research is not problematic unless it's really top heavy on research and then you have like 2 hours of shadowing or clinical, then it's problematic. So I would say, yes, there kind of is a little bit of a tilt in favor of clinical over research or just only shadowing. A blend of all of them is not problematic. That's how I'd answer that. I think most schools are going to, because you're looking to become a physician. So having experience, shadowing, following, being in a healthcare setting will all speak to the foundation that you're building that we can then build upon in medical school, knowing that you kind of have an idea or working knowledge of what a physician actually does is important. And sometimes you don't get that when you're doing research, you know, at a wet lab or bench research, things like that. And you get that a little bit more with shadowing as well. So it's riding that line. I don't think you're going to be slapped on the wrist for trying to balance things or have a little bit of each, but too research heavy could potentially be problematic, depending on if you don't have any clinical or very low clinical.
Gotcha. Thank you very much for for your comment. I'm pretty sure like it's all duly noted. And I'd also like to say that this is my first time being in one of your workshops, so I'm genuinely happy that I came here because it was very. I was actually like, how do I say it? Like I think I'm attending UC Davis at the moment and I'm a sophomore. So last quarter, I actually just like had kind of this, I guess, spiritual awakening that, oh, psychiatry is super cool. I want to do psychiatry.
That's awesome. That's awesome.
So I was also like attending like therapy sessions because I was having some mental problems and like everything was just too stressful for me. So like just last quarter, I ended up making the decision that I want to become a psychiatrist and go into med school. And after that, like I came across your YouTube channel and many others, and then I've just been absorbing as much information as I could.
Don't worry about the others.
But yeah, I was just worried that like I'm somewhat late to the party, and like well compared to my peers, I just felt worried that like my questions may be more trivial when compared to theirs. I mean, of course, like as they were asking questions, I felt like my questions were far too trivial, and it like reinforced the anxious feeling to like ask questions. So
R4, tell us more about your feelings of in that way. No, I'm kidding.
We're all big fans of therapy here. So.
Yeah, right. Oh, absolutely.
Weekly.
Yes,
people.
Right.
Yeah.
Gotcha.
Awesome.
Well, thank you very much very much for this like very informative workshop, and I hope to attend the ones in the future, the ones you guys have planned. Thank you very much.
We'll be looking for you.
Yeah,
and UC Davis is a great school to get you prepped for medical school. Had lots of really successful students come out of there.
Yep. October 6th through 8th, MappedCon. I just put a link, mappedcon.com. We are doing our first in-person conference. So think about this little workshop. There were about 60 or 70 people on here at the max. Think about 1,000 students. Some of you that may cause some anxiety. That's okay. But 1,000 students, the energy and atmosphere when you bring students together along with experts. We're going to have lots of admissions committee, deans and directors, and from both pre-med, pre-PA, pre-vet, all of that stuff, all in one location, October 6th through 8th in Baltimore, Maryland. Early bird tickets are on sale right now at mappedcon.com. So go check it out. Friday night will be a non-traditional night. I'm going to update the website tonight with our kind of rough schedule. We have lots of confirmed speakers and lots of kind of nailed in topics already. So I'm going to update the website. So go check it out, mappedcon.com. And with that,
we've got connections that we're going to share with you guys. So come meet all of our friends,
come
our
meet
deans
our
and
friends.
directors.
Exactly. That's basically what it is. Just come meet our friends.
Yeah.
Is this recorded? Yes. The recording will go out to everyone. It will. Dr. Scott Wright, former director of admissions at UT Southwestern, retired executive director at TMDSAS. Courtney Lewis, former director of admissions at Burrell College of Osteopathic Medicine, and myself, Dr. Ryan Gray, former director of nothing, but all around cool guy. Thank you so much for hanging out with us for the last hour and a half. Go check out premedworkshops.com. I believe it's with an S, maybe. You'll find us, medicalschoolhq.net, for all of our amazing free resources. And come join us in Baltimore. Bye-bye, everyone.
Bye.